Hi, my name is El-Khatib, and I'm going to present to you the project on the children immunization app, where we used a holistic approach for this project. It's called the CIMA, the acronym, which will be used during the presentation. This project was made in Jordan in the Zatari camp for the Syrian refugees. I think all of you are familiar with the yellow card, and you know that this is usually, it's not easy card to use, although it's very useful and helpful. So imagine being a parent and you have to record the vaccination records of your children. Myself, now I am dealing with it with my 6 months old child, and it is already a headache. So imagine when having more than one child, and then you have to learn all the acronyms of the different vaccines, and you have to remember also each vaccine, what does it stand for, and when to go back to the clinic, so the health staff can give the child the follow-up dose. And of course, when we forget what this vaccine is about, then we go to Dr. Google, especially when we are not trained in the health field as parents. And sometimes we find a level of misinformation on the internet, which can be also discouraging for us as parents. That's why we should vaccinate the children. Now, on the top of this, imagine being a refugee who you had to run away to flee your life with your children, and you don't even remember exactly what were the vaccine taken back home. And then you have to adapt to the new host society with all the healthcare system structure. And also you have to get your children vaccinated, and you have to learn them again. So the Zatari camp was established in 2012 in the northern part of Jordan, on the close to the southern part of the borders to Syria. And it's considered the second largest camp in the world in terms of density. And it has almost plus or minus around 90,000 residents. The camp has several clinics, and they provide also vaccination to the parents. The project started with the idea that there is a need to have digitalization of the vaccination history, so parents can have the vaccine history on their smartphones, and also to provide them health promotion regarding the vaccination, which was provided from UNICEF, plus health information regarding the vaccine and what do they prevent. And also, due to COVID-19, we added a component on parenting skills, which is provided from the UNODC. These material were already provided on for parents to support them in crisis mode, or in general in the host society before COVID-19. And then there was an adaptation for the COVID-19 as UNODC response. So this app became a platform to be able to support the parents using the smartphones. In general, parents in the camp, they have smartphones, mainly Android phones, and they have access to the internet, but they don't know really what to trust. And this app came in a very good timing to match the need of the parents. The camp has kind of a semi-permanent structures, but not 100%. So the parents mainly the households are made mainly of containers, but not all roads are well established. So during winter season, for example, it's a hassle to get to the clinic. And usually with the apps, we used the traffic light system, so parents can remember immediately by opening the app and looking which color, when it's red, it means, oh, I missed this appointment for my child. If it's orange, it means, okay, I still have time. I have to check when I have to get my child to be vaccinated. And if it's green, it means it's done. The parents, they can manage the data themselves on the app, so they don't need the internet. They get reminders, 3 reminders before the appointment and 2 reminders after if they miss the appointment. Also, the reminders are integrated inside the smartphone calendar, so they don't need internet to be able to have reminders. So it doesn't come as an SMS, but as a pop-up window on their phone. The health promotion material was developed by UNICEF, and it was tested and validated by UNICEF for this context. So we only used the leaflets that was provided by UNICEF. So this project was done the first phase where we tested the app, where we enrolled around less than 1,000 children, 50% in each study arm, in the intervention, half of them in the intervention, half of them in the control study arms. Here you can see the distribution in terms of these bubbles, the locations of the households. The red is the intervention, and the blue is the control study group. When we looked at the comparison between the intervention and the control study groups, there was barely any difference between them, except regarding the decision-making in the household. In the intervention group, it was mainly more likely the fathers to be the decision makers regarding vaccination. In the control group, it was the moms. And then here I share the data when they came back to the clinic. We looked at one appointment when they came back, and usually we took 7 days as the cutoff point. So we can see a slight difference here when we look at it only in terms of this table in terms of the analysis by comparing them. But I will show you later a Kaplan-Meier survival analysis where it shows better the impact of the app. And I have to add a caveat here that the parents, the children who did not come back to the clinic, we couldn't call them 100% as lost to follow-up because we tried to trace some of them and they moved outside the camp. So in Jordan, the system is very flexible with the refugees. If they would like to move outside the camp, the families, the government has no objection. And most of the Syrians, they are entrepreneurs, they open their own shops. The area there, you can see that the refugees, they have actually created a huge economy in the area because Syrians are entrepreneurs in their nature. So when parents didn't come back, we assumed more likely that they moved outside the camp. We couldn't do follow-up for all of them, so therefore the data is missing because we couldn't call all of them because of lack of resources simply. Here, when we look at the impact of the app in terms of reminders, we can see that there is a risk reduction around 9%, that children come back within a week time, and this is an acceptable period of time. So according to the Ministry of Health, they will not be called as defaulters. Now, the approach that we have used here, we did an inclusion for all stakeholders in this process, because technology alone as a phone machine or as an app doesn't work if people don't use it. And people will not use such an app if they don't have level of trust in the entity that is providing the service. So throughout the process, we have included all stakeholders, all organizations, to inform them about this project. And also we informed community representatives as well. So then when we start, and also the staff, when they were trained, we also trained locals as well on the app. So everyone was really well informed throughout the whole process. And when parents, they ask us to do some updates, or as there are certain things they didn't like in the app, also we were fixing everything on the spot. To be able to really serve the need of the users at the end. And this process, we believe it was very useful and helpful to build the trust with the parents, especially in a setting that is for refugees, which they are very vulnerable. So also UNICEF, UNHCR, the local police were informed as well. All of them were informed, and they were on board in this project because they could see it's very useful and helpful and needed as well. And of course, the Ministry of Health and the Jordan University of Science and Technology, just. Now, when COVID-19 happened, of course, there was lockdowns in the country, as all countries in the world, and residents of the camp got affected. And here we did a study to look at the reported cases related to mental health, and we could see there was a peak happened just a few days, 2 to 3 days after the lockdown. So therefore, the need to support parents in terms of for mental health and the children became high, but the access to the camp became also limited due to the lockdowns. So here we have integrated the parenting skills material into the app, where we enrolled 1,100 children. That was done in February, March of 2021, this year. And parents also informed us that they trust the app and they can access the internet, but they don't know what to trust anymore in terms of COVID-19. So we, on the top of this information on the parenting skills from the UNODC, we also added information on COVID-19 and excuse me, and COVID-19 vaccination. So then parents are well informed about the pandemic. Now, the way to move forward, the next step would be piloting the app in Rwanda at a public clinic, and in Cameroon as well. And in Cameroon, there are HIV infected children will be included because also of the peculiarity for the immune system of children infected with HIV, that to come on time for vaccination, they are a very vulnerable group. And also in Cameroon, they requested to add COVID-19 vaccination history, so adults can also use the app. So then it becomes also more of a holistic approach for parents or adults and children. The app, in Jordan, it was done in English and in Arabic interchangeably. In Rwanda, it will be done it's already developed and it is in English, and in Kenya, Rwanda, in Cameroon, it is in English and in French. So as well, the material, we did the same for each country, depending on the official languages and what our collaborators have requested. So as a take-home message, the lesson learned that the scalability is possible, and the app is low cost, is for free, provided to the users. We did a holistic approach, so everyone is included in the process. It is easy to use this app, and also we are leveraging current knowledge from UNICEF, from WHO, from UNODC, so we don't have to reinvent the wheel. The partnership model also has strengthened the local ownership for the app by the users. We did a digital transformation for the currently available information. So we did not try to invent a new system. We just tried to test if we do a digital transformation of the physical system, can this work? and it did work. We were always responsive to the community needs, which is very important, so they feel that they are heard. And also all the time, patient was the center, or the user was the center of this whole process. Finally, I would like to acknowledge all our collaborators and donors, because without them, we couldn't really do this project. Thank you very much.